Some drug combinations are more dangerous than people realize. And you may think you're just taking regular meds or drinking something healthy, but the wrong mix of two different meds or a medication and some type of food could land you in the ER or worse. So, the verse that comes to mind here that I love is Hosea 4:6, and it says, "My people are destroyed for lack of knowledge." My people are destroyed for lack of knowledge. And when it comes to medications, medication literacy, people understanding what their medications are for, what they do, what are the things to watch out for, this verse really hits home for me because it's not usually the medicine that destroys us. It's the lack of understanding how that medicine interacts with something, how it works, and how it fits in your overall lifestyle. A pill plus another pill, a pill plus a supplement, a pill plus some fruit that you just like to eat. Sometimes that can be an issue. So that's why I want to talk about today in this video, what you can watch out for and really what are some of the more common combinations that people are running into, because when you know better, you can do better. And it goes back to awareness, access, and action. So if you're not sure and you're new here, my name is Takova Wallace-Gay. I am the community's pharmacist. I am a medication literacy advocate. And for over 10 years, I have helped patients, families, and communities stay safe with their medications. Today, I want to break down 4 dangerous medication mixes that you need to know about. The first medication mix is blood thinners and NSAIDs. So blood thinners are things like warfarin, Eliquis, Xarelto, things that we use to help prevent our blood from clotting up. And if you have a history of atrial fibrillation or if you've ever had a blood clot, then you're probably on one of these medications. And those medications can interact with NSAIDs like ibuprofen, naproxen. If you're getting those over the counter, it could be Advil or Aleve. And the thing is that we're not always prescribing or even recommending that you take an NSAID. You can go and get that from your pharmacy. So if you have one of these blood thinners at home and then you mix it with your NSAID because you're having a little bit of pain, you're just taking a pill every day, it could be an issue. So let's talk about what happens. Both of these can thin your blood. And when combined, your risk of having a major bleed skyrockets, specifically an internal bleed, things like GI bleeds, bleeds in the gut, and even a brain hemorrhage. So if you are on a blood thinner, I would rather you reach for something like Tylenol instead of an NSAID, but always double check with your doctor or pharmacist, because taking a dose here or there is not going to be an issue. It's if you're having to continually take these two things together that it becomes a problem. So the second combination I want to talk about are statins and certain antibiotics. So if you have high cholesterol, or you may also be on a statin if, like, for example, you are over 40, you have diabetes, and we're trying to reduce your risk of having a heart attack or a stroke. So statins are used for multiple reasons, not just cholesterol lowering. And examples of these medications are atorvastatin, rosuvastatin, simvastatin. Some of the brand names are Lipitor and Crestor. And so when you combine these statins with certain antibiotics like clarithromycin or erythromycin, these antibiotics can block how your body breaks down that statin. So statins for some people have led to muscle pains at baseline, and not all of them lead to muscle pain. I love talking to people about statins, so I can do a whole separate video on statins later. Let me know if y'all want to see that, because I would love to talk about statins if that's something that you want to hear. But for this particular conversation, the antibiotics can block how your body breaks down the statin and gets it out of your body. So if it prevents it from breaking it down and getting out of your body, that means the level of the statin is going to be a lot higher in your bloodstream. And that means that it's hanging around longer to wreak havoc or cause issues with your muscles. So then your muscles can start to break down. This first shows up as just like mild muscle pain, but depending on the person, it's hard to predict. It could progress quickly to what we call rhabdomyolysis, and this can damage your kidneys, and it can also be life-threatening. So always talk to your provider or your pharmacist. Make sure they know what meds you're on before starting antibiotics. And, you don't have to remember these. Just always ask the question, is this going to interact with any of my other medications? Make sure they know what you're taking over the counter, what prescriptions you have from all of your different providers, and that way everybody's on the same page. Sometimes a quick switch to a different antibiotic for those few days that you're going to be on it, in most cases, can make all the difference. So the third potentially dangerous combo is going to be ACE inhibitors or ARBs and potassium supplements. And I'm going to tail off with this one a little bit as well. So ACE inhibitors and ARBs are things like lisinopril, losartan, anything with pril on the end. So you could be on lisinopril, ramipril, enalapril, and then the angiotensin receptor blockers are anything with sartan on the end, losartan, valsartan. So most people are on those if you have high blood pressure, if you have other heart conditions, that could be heart failure. If you've ever had a heart attack, you are probably on one of those. If you're not on one, then figure out why you're not on one, unless you've had some issue with one in the past. So those are our lisinopril, losartan medications. And then if you combine that with a potassium supplement, that could potentially increase your potassium levels really, really high. Another medication to watch out for in this is a medication called spironolactone, which it goes by a couple of different classifications, but it's partly a diuretic, but it increases your potassium levels. So lisinopril, losartan, spironolactone all cause your potassium levels to increase a little bit. And that's normally not an issue. We monitor those labs, all of that. But if for whatever reason you're taking potassium pills or salt substitutes for one reason or another, and again, this could be because you want to do this for your health and not realizing that both of these things are going to increase your potassium level, then you can potentially push yourself into way too high potassium levels, which is called hyperkalemia. And a dangerously high potassium level can cause abnormalities in your heart rhythm and even sudden cardiac arrest, which can lead to death. So don't start a supplement on your own. Get your labs checked regularly. And just because it's over the counter doesn't mean that it's safe with your prescription. So always ask that question. The other thing that I wanted to mention here, and this is just a side note, this isn't even part of my 4. I'll get to my 4th one later. So a side note here is that these medications, the ACEs, the ARBs, so those medications that end in pril, lisinopril, ramipril, and the ones that end in sartan, so losartan, valsartan, mixing those medications with like an NSAID that we talked about earlier, which is ibuprofen or naproxen, and also being on a diuretic like spironolactone or HCTZ or chlorthalidone. There are others as well. Having all 3 of those medications together is not that uncommon because we are treating conditions like high blood pressure, heart failure, etc., that these 3 medications together might be beneficial. I could argue with the NSAID, but it's thrown in there as well. When you're on all 3 of these medications together, it increases the risk of an acute kidney injury. Doesn't mean it's going to happen. It just means that it increases your risk of having one. And the reason why I felt the need to go off on that little side tangent is because this week in clinic, I was consulted on a couple of patients and both of them were on this combination, one of which we ended up changing because their kidney function was not where we wanted it to be, and especially for them to be on that. The other patient was actually on all 3 of those, but they were on 2 different NSAIDs. And so we were recommending that they stopped one of them because you don't need 2 of the same medication in most situations. Like you don't need something working the exact same way. It's just extra stress on your body, extra drug in your system for no reason, and unnecessary cost. So we recommended to stop that one. But I say all that to say, it is definitely on us as the healthcare team to monitor what all you're taking, who all you're getting that from, what you're getting over the counter. But it's also on you as the patient to keep track of what are all the things that you're taking. And even if you took something short term and you're not going to continue to take it in the long run, we need to know about that because it could potentially interact with your medications. If you change something in your diet and you decide you're going to go and live this separate, different lifestyle. Maybe you're going to go vegan and that requires you to eat certain foods that you hadn't been eating before. That might be something to let us know in case there are some interactions that we need to watch out for. And so I do have what I call a medication mind map. And we know there's data that shows us that concept mapping and just writing everything out and mapping it all together helps you visually remember things, understand things a lot better, and specifically for your health will lead to just an overall bigger picture of what all your medications are and how they're working. So I do have a link in the description box. It's free. Just try it out, see how you like it. But I really think it would be helpful to keep all of your medications in one place and just build that med map around one medication. How does it work? What are some side effects to watch out for? What's the dose that I'm taking? Who's prescribing this for me? All of that I think can be helpful. All right, done with that tangent. Now on to dangerous combination number 4. So this one is somewhat tricky. I have gotten a lot of questions about it, but it's grapefruit juice and certain medications. The most often I get asked about is grapefruit juice and statins. So we talked about statins earlier, simvastatin, atorvastatin, rosuvastatin, all of those. But grapefruit juice can also interact with calcium channel blockers like amlodipine or diltiazem or verapamil. It can also interact with some medications that are used for anxiety and medications that are used for sleep. So what happens in this case is that the grapefruit juice blocks an enzyme chemical that's in your stomach that normally helps you break down drugs. And so since it's blocking that enzyme or that chemical, now you can't break the drug down. So even just one glass of grapefruit juice, 8 ounces, can make your drug levels spike to toxic levels. So I think it's a misconception. People think that you have to drink a lot of grapefruit juice, a gallon, or you got to just be like drinking it all day. No, it can be one glass of grapefruit juice that can make all the difference for you. And it's really hard to say how it's going to affect one person versus another because everyone is different and everyone is on different medications. But just know that even 8 ounces can affect you. So there are other things too that are citrus-like fruits, such as certain types of oranges. I can't think of the name of the one I'm trying to recall right now, but there are other citrusy type fruits that can interact as well. So just do your due diligence and look into that. And these effects can last up to 3 days. So whatever toxic effect you caused with that medication, which could be that it is causing your blood pressure to drop too low, or it could be causing muscle pains for you, that could last for up to 3 days. It can also lead to liver damage, heart rhythm problems, and just really, really dangerously low blood pressure. So if you are on a medication and you see that little sign that says, do not take with grapefruit juice, please take heed to that. You may want to just avoid it completely or try to swap it out for some other type of juice that you enjoy. If you are a grapefruit juice drinker and you're like, I don't want to cut that out of my life, then maybe talk to your provider to see if there's a different medication that would work just as well. So the bottom line here is that medication safety is not just about the pill that's in your hand. It really is about everything working together, how you take medications, as well as your lifestyle. So I like to tell people you have to keep your medications organized for yourself, as well as for the people around you who are helping you manage your medications. Otherwise, these small mistakes, they just kind of like slowly sneak in and creep into your lifestyle because you didn't go back and review and monitor and check. A small little hinge, like a cup of juice or taking an extra pill, can swing a very big door open and lead you down a path that you don't want to go down. I'm always wanting people to understand that you are the CEO of your health. You are in the driver's seat. So don't leave these things to chance. Again, I have the medication med map. It's a free tool. You can track what meds you're on. You can look for duplications or like taking double things, dangerous combos. Also help you to just ask smarter, more informed questions when you go to the doctor or to your pharmacy. And you can download that in the link below to get started on building your med map. If you enjoyed this video, learned anything from it, do me a favor. Like the video for me. Don't forget to subscribe. I will be posting videos every week that will hopefully help you feel more confident, more informed, and empowered when it comes to your health and your meds. Just breaking down medications in a more simplistic way so that it takes out all the overwhelm associated with it, and also so that you can help manage your care and maybe you're helping care for someone in your family as well. I'll end with this. Your health is way too valuable to gamble with. I truly believe that. I have lost people in my family because of leaving things up to what somebody else told them to do and not checking and verifying it for themselves or knowing it for themselves. So don't let a simple combination of something take you out. Build your mid-map, stay alert, and continue to build your bridge to better med taking in the future.